Robbie Leonard with us, and she is a Clemson graduate and a former AED president. So we're really happy to have her. And she is the manager of Proaxis Therapy in Greenville.
Well, good evening. Thank you for asking me to be here. I'm excited to be here. Walk in the door, haven't been a long haul in several years, many years. Smells the same. That hasn't changed. I'm sure Jordan Hall hasn't changed either. But it brings back lots of good memories. So spent lots of hours in these two buildings. I'm sure you are doing the same. Tonight, going to talk about the profession of physical therapy. But I would love for you guys to make this informal and, don't save your questions till the end. If you have a question, ask me as we go. You will not interrupt me at all. And I gave you a handout, a couple of things on the handout. All the slides that I'm going to show you are in your handout so that you'll have that as a reference. But in the back of your handout, and I apologize for the fine print, but I did not put that grid sheet together. There is a grid sheet for all of the universities that offer physical therapy as a degree, and all of the requirements, prerequisites that you would need to get in order to enter into their program. So for you guys who are thinking about becoming physical therapists, that might be a good reference tool for you. I'll show you where it lives on the internet in case you need it. But you need to think about those prerequisites early so you make sure that you're getting everything you need if that's your interest. If you're not interested in becoming a physical therapist and you're in some other medical field, pre-dental, pre-medicine, pre-health administration or whatever, you are going to end up working with physical therapists. So hopefully I'll give you some information about what we do and where we work and some of the roles that we play. So we'll get started. Oh, and by the way, this is my email address, robbie.leonard@proaxistherapy.com. Didn't come out in print very well, but if you have a question later on and you want to ask, feel free to email me. I'll answer you and try to get you some information if you need it. So, let me tell you a little bit about myself. I am from Ringgold, Georgia. Who knows where that is? 3 of you. That's awesome. All right, so red shirt in the back. Where's Ringgold?
Isn't it near Chattanooga? That's where I'm from.
She gets a prize. Now, there are really good prizes for interacting with me. So we'll just start that off with that, and we'll be filling that. I came to Clemson in, I'm afraid to tell you guys this, but 1982, graduated with a degree in microbiology in 1986, went to Duke to PT school and graduated from PT school in 1988. So I have been a physical therapist for 21 years, and it's a great career. And so I'll share a little bit with you about my experiences as a PT, as well as going through school and what it's like and what you might expect. How many of you are interested in physical therapy? Excellent. Very good. How many of you are pre-med? Excellent. Pre-dental? Pre-pharmacy? Nobody? What did I miss? Anything else? Got everybody? Cool. I have worked in a lot of places in my career, and I started off my career at the Shepherd Center in Atlanta. Anybody know what the Shepherd Center does?
Helps people in wheelchairs.
You're very, very close. I think that's what I don't know what sizes I have. Y'all might have to swap around as time goes on, but anyway.
Thank you.
All right. So you're very close. When I was at the Shepherd Center, it was a rehab facility for persons with spinal cord injury. And now it's a rehab facility for persons with spinal cord and brain injury. And one of the things in physical therapy that you get to do is there's just a wide variety of settings that you can work in. And one of my areas of interest was spinal cord injuries. One of my little sisters, I was a Kappa Alpha Theta when I was here, and my little sister was a person with C6 level quadriplegia. And she had rehabbed at the Shepherd Center. And I actually worked there, which was kind of cool. I left the Shepherd Center and went to a little place in the middle of nowhere. Anybody ever been to Warm Springs, Georgia? Okay, who knows what Warm Springs is famous for? Ooh, right there. Yes.
Teddy Roosevelt. Or Franklin.
There you go, Franklin Roosevelt, another Roosevelt guy. Franklin Delano Roosevelt, and what did he have? Do you know? What disease did he have? Polio. So it was a polio rehab facility back in actually established in 1927. And now it's just a general rehab facility. But my definition of rural, it's 45 minutes from Walmart. 600 folks, one red light in the middle of nowhere, about an hour and a half southwest of Atlanta. And so I was director of rehab there. We had a 65-bed rehab unit, 150-bed vocational unit, 900 acres, 12-acre golf course, 12-acre lake in the middle of nowhere. We moved from Warm Springs to where we live now. We live in Easley. How many of you know where Easley is? You don't get a t-shirt for that. All right. And I went to work for the Medical University of South Carolina. Anybody planning on applying? I know some people don't. I worked for MUSC for 4 years when they had the physical therapy program at the University Center in Greenville. And so helped start that program and worked through that program for 4 years. They don't have that program anymore, but still do some teaching in the administration classes for PT students at MUSC in the summer. So I'll give you some good news about getting in. Left MUSC, worked for St. Francis Hospital as director of outpatient therapy, helped open the AmMed Health South Rehab Hospital in Anderson. I don't know if any of you have driven by that. And for the last 5 years, I've actually owned my own business, Leonard Physical Therapy. And mostly I have taught continuing ed classes around the country. I've done consulting. I have seen a lot of people in wheelchairs. And in February of last year, I went to work for ProAccess Therapy as Vice President of Administration. So who knows anything about ProAccess? Anybody? Have ever been treated? So I have had a fun career so far and plan to have many more years of that. This is the rest of me. Mike is a Clemson grad, and so this is Erin, our daughter, and we're nudging her to come here. There's only one rule: she cannot go to Carolina. That's the only rule. Well, she could go to Carolina, but our money's not going to Carolina, so you know she probably won't go. The rest of the family. That's it. All right. Ooh, wow. Interesting. Maybe the lights. I don't know. It was showing up good while ago. Or maybe not. Oh, we've never had that happen.
There's nice little handouts.
There it is. Oh, cool. Strange. All right. So, who are physical therapists? PTs are healthcare professionals diagnose and treat people with a variety of medical problems and other health-related conditions that limit their body to move and function in their daily lives. Now, that's the APTA definition. Who knows what the APTA stands for? Christine, the good answer.
American Physical Therapy Association.
Woohoo! Yeah. She gets to be here. American Physical Therapy, and there's not an unending supply of these, so American Physical Therapy Association is the entity that is a membership group, and if you're a PT, you usually belong to the APTA. It's kind of like the American Medical Association. It's the group that sets policy, lobbies, etc. But I like to think that the short version is we're body mechanics. So basically, when it's broken, we try to fix it. How many of you have had PT? All right, a lot of you. How many for orthopedic condition? Injured during a sport? Yes. All right, so you have had first-hand experience. So this is funky. I've used that template before. What do physical therapists do? Well, we examine people, develop treatment plans, help you to move better, reduce pain, restore function, or prevent disability. The other realm that PTs is to work on health and wellness. And how many of you do you have health and wellness classes in part of your pre-health curriculum? No. Big push in the medical world right now is to make sure that not only are we treating illness and injury, but we're trying to prevent illness and injury with prevention. One of our campaigns, who's got their t-shirt? you look on the back of that t-shirt, how many of you know that females are very predisposed to ACL injuries? Yeah. How many of you have had an ACL injury? Okay. Anybody rip an ACL and had that surgery? Not nice. So you understand the rehab process for that is not a whole lot of fun. But girls are very much predisposed to that. So one of the things our company is doing is trying to teach female athletes how to not tear their ACLs and prevent ACL injuries. So not only are you focused on treating illness and injury, but also in keeping people well. What conditions do physical therapists treat? Well, pretty much if it's a medical condition, you can usually see a physical therapist related to that or treating with the other healthcare professionals that we work with. So orthopedic conditions, that's usually the first thing that people think of. Sports injuries, orthopedic injuries, back injuries, those types of things. But other things, joint and soft tissue injuries. There are hand therapists. There are folks who work specifically with hand injuries. We have people work with fractures, dislocations, neurological conditions. That's my specialty. My specialty is working with patients with stroke, brain injury, and spinal cord injury. That's my love. So everybody kind of does a little something different. Integumentary conditions. What does integumentary stand for? Very good. Burns, wounds. So we have folks who love to do wound care. Not my love. So again, it depends on what your interest area is. Arthritic conditions, usually associated with older adults. Systemic conditions. We have therapists who do oncology rehab programs. Cardiopulmonary conditions, cardiac rehab, and workplace injuries. We have folks who actually go out into the workplace, work. We have some therapists who work at BMW. That'd be kind of cool. Go out and look at their workstations and see what they can do for setting up work conditions that don't get you injured. And sports injuries. And that's typically where people start when they think of physical therapy, is that we work with athletes, and that is one component of PT. Where do PTs and PTAs practice? All right, who knows what a PTA is?
Physical therapy assistant.
Physical therapist assistant. Physical therapist assistants have a 2-year degree. They work, they usually get their degrees at a technical school. Greenville Tech offers a PTA program, and that is a 2-year technical degree. Physical therapist assistants work under the supervision and direction of a physical therapist. Anybody interested in being a physician assistant? So we have some similar relationship with our PT assistants where they work under supervision and direction of the physical therapist. The cool thing about being a PT, one of the cool things, is that you get a lot of choices about where you work. Most medical professions, you have this. You get to choose. You want to be in a hospital? You want to be in private practice? Do you want to work in the school system? Do you want to work in a nursing facility like older folks? Do you want to work in a rehab hospital? Pretty much, do you want to work in the work environment? Pretty much anywhere you want to work in the medical field is where you will find physical therapists. We have physical therapists who just do research. So there's a huge variety of what you get to do. One of the things that I like is that as a career, you get a large choice of where to work, and you also get a large choice of when to work. I have therapists that work for me that work, I call them school hours. I've got some mom PTs that work 9 to 2. I don't work 9 to 2. I work 9 to 9. No. It's all about choice. It's what you want to do and where you want to work and what hours you want to work. So there's a lot of flexibility in physical therapy as a career, which is very cool, in lots of places. What do we do? Well, what you primarily see, how many of you who've had PT, were you given exercises to do? Did you do them? A lot of what we do and a lot of what you see therapists do is therapeutic exercise. And that is using the body to try to heal and rehabilitate the injury or illness that you have.